We're going to talk about first aid, basic first aid. This is Jim, I'm Rick. Well, I was going to make it a fake name. We're just talk about basic first aid, what you can do if you come across something to help. First thing is safety. Safety is first and foremost, because if you're trying to help somebody and you're not concerned about your safety, you can become a victim just like that. So a lot of times you come on somebody who's unresponsive, they're passed out. You know, what caused them to pass out? Was there gas in the residence, something like that, or gas in the whatever? Did something fall and hit them and it's still unstable? It's hard to know. So look around before you just run in and try to help somebody. Worst case scenario, you go in and you become a victim yourself. You're not helping anybody. It makes the whole situation worse. So once you've kind of got the safety thing, you've looked around, you know everything is safe enough to enter, you want to do a good size up. You know, kind of look around, see if there's anything that maybe caused that. See if there were pill bottles, that type of stuff, and then call 911. Call for help. You know, get somebody else involved, so it's not just you trying to take care of this person by yourself. That way, if somebody can be on the phone with 911 while you're trying to render care, right? So get somebody coming. The sooner the better, and believe you me, it's going to feel like a long time. No matter what, it could be 2 minutes down the road. It's going to feel like you were there for an hour by yourself trying to help this person. When you approach them, you want to see if they respond to you. If they respond to you, then they are responsive. If they do not, they are unresponsive. You can kind of give them a pinch or a rub to see if they'll respond to a pain, but we want to avoid slapping or splashing water on them. That's not going to help anybody. If they're unresponsive, we want to look, listen, and feel. We want to look to see if their chest is rising and falling, because that would indicate they're breathing. Listen for breathing, and feel for a pulse. So if they don't have any of those, or one or more of those things, you have a problem. We're going to want to start CPR. Have you guys taken CPR on that? Okay. I know they stress in CPR, I think, 30 to 2. The most important thing is to get your hands on the chest and start doing compressions. You want to do it at a rate of 100 a minute for as long as you can go, basically. They have oxygen in their body. You know, they can go a couple minutes without taking a breath, but you can't go very long without your heartbeat. So getting your hands on the patient, doing those compressions is the most important thing. The heart kind of works off of building pressure, and it works off momentum. So once that stops, it's going to take a little while to get the blood circulating again. So every time you stop, you kind of slow the thing down, and so we're finding we're having a lot better returns by focusing on just compressions and kind of making our ventilation secondary. If the person is breathing, that's great, and if they've got a heartbeat, that's great. Very common problem with somebody who's unresponsive is diabetes. They'll have low blood sugar, hypoglycemia. You know, they didn't eat a meal, they skipped a meal, maybe they took a little too much insulin, and now they're unresponsive. Very common, and the nice thing is if you call us out, we can fix it right away. We give them a shot of sugar and they wake right up. Anything under 60 milligrams a deciliter, which that's, you know, they poke themselves with the meter, you check it, anything below 60 is they start to have a change in their level of responsiveness. They start to act a little drunk, so that's kind of what happens. And then as it goes lower and lower, eventually they'll pass out. So that's very common. Some things we don't want to do with somebody who's unresponsive. We don't want to put a pillow under their head. They're not going to notice that it's not comfortable to lay on the floor because they're passed out. A blanket's not a bad idea. That's not going to hurt anything. We certainly don't want to put anything in their mouth. You know, if we think they're having a seizure or something like that. I think Chief Killian handled, covered that before, because we're making the problem worse. Don't try to, give them any food or drink, because that doesn't make, you don't give somebody who's asleep food, right? So, but believe it or not, it happens. Oh, they're diabetic, we'll put a Twinkie in them. So, watch out for that. If they're alert, typically they're going to be able to tell you what ails them. If they're bleeding, well, then you want to stop the bleeding. That's a pretty simple thing. We're going to do that with bandaging. Our front line of defense against bleeding is going to be a very simple 4x4 pad or 2x2 pad and direct pressure. That is the best way to stop bleeding, is direct pressure and a bandage, a dressing. If you don't have a sponge, a 4x4 or a 2x2, feel free to use something that's clean, something, clean towel, something like that. Good amount of pressure. You're not gonna put too much pressure on that wound, and slow the bleeding. Because once the blood's out, you can't put it back. So that's a whole thing. Any questions about blowing and stopping?
What about universal precautions?
If you have gloves available.
Well, so you don't.
Exactly. So typically you're not going to have gloves available, but if you do, more power to you. If the person's alert enough, you can have them hold the pressure themselves, give them the towel. Nothing wrong with that. If it's a severe enough injury where you're looking at they're potentially going to bleed out, quick check of your hands. Do you have any cuts on them? Because if your skin's not broken, you're pretty safe. I'm not advocating you go out and stick your hands in blood, but in a pinch you should be fine. Just wash with soap and water afterwards. That's kind of the way you go. Most of us have been exposed to blood one time or another. As long as it's unbroken skin, it's pretty. You don't worry about it. So, direct pressure's your first line. Your next is going to be a tourniquet, belt or something like that will work really well. You kind of want to go until the bleeding stops. So you're going to keep pressure on it until the bleeding stops. You're going to tighten the tourniquet down until the bleeding stops, or slows. You may not get it fully stopped, but as tight as you can get it, you're not going to hurt them. They're going to end up bleeding out otherwise. So, any other questions about bleeding? No? If somebody breaks a bone, well, they're in you happen to come across them. You splint that. We have these fancy ladder splints, and the SAM splint here. This is pretty old stuff. We don't use these very much anymore, but we still carry them. You can bend them a little bit for form, but they also will snap pretty easily because they're just not really meant to bend as well as these things are. This is basically like a thick piece of aluminum foil in there, and it really can conform really nicely. You're going to put that around the broken thing because whether it's an arm or leg, it won't work that well on the leg, but it'll work. Splint it because if it moves around much, you're going to have a lot of pain. We use this Curlex a lot. Once we get enough pressure to stop the bleeding, we use the Curlex to wrap it and stop it. Same thing with a splint. We'll use that to hold it in place. Works great for that. A little bit of tape to hold it. You want to make sure if you are splinting, especially an arm, splint the hand as he was kind of demonstrating in the position of function. So kind of like this. Because if you keep it flat on the board, it gets really uncomfortable for them. They tend to try to move it. So if you just stick a Curlex in there or something else that allows them to kind of ball up their hand, there you go. He's demonstrating making a sling. You can, yeah.
It's kind of hard to do it by yourself, I'll tell you that.
This is a triangle bandage. They're probably going to be in your kits over there. you tie a little knot back here, which makes a little pocket for the elbow, and then you tie the two ends together, and you've got yourself a very inexpensive and very easy to make sling.
Use a towel at home too.
Towel work or anything that you know basically resembles a large triangle. You can also use like ace wraps or our friend the Curlex to secure that arm to their body. That will work. Basically, we just want to immobilize it. We don't want it to move around because that's just going to cause them more pain. Any questions on splinting? Did you guys see the Curlex?
Do you have recommendations of things to use at home when you don't have those things?
Oh, yeah, we covered that with the last group. Sorry. If you're at home, if you've got, say, a 2x4 or something like that, it may not be, in your kitchen, I get that, but it may be in the house somewhere. Also, broom handles work pretty well, if you had to. Obviously, it'd be fairly long, so if possible, you kind of want to take that down. If you can get end off the toilet plunger. I mean, anything that's long enough and hard enough, you just want a solid surface to secure that arm, that extremity too.
A cutting board. I mean, that might be a little wider than, it's better than nothing. Just look for stability, more stability than.
So if you have if your 6-year-old falls off the bed, and you think you broke his arm or elbow, what would you do?
Just sling us off the elbow, wrap it in a pillow, take a pillow and wrap it around it, and then we'll Curlex it all the way around, and then get it up close to the body. They want it as close to the body as possible. That's their comfort.
And a lot of times when somebody injures themselves like that, even little kids, your natural inclination is to put this where it feels comfortable. And that's where you want to leave it, because that's causing them the least amount of pain. So if this is where that's comfortable for me, that's where we want to try to leave this.
That's how I knew my daughter's arm was broken, because she didn't really cry, but she kept carrying it that same way, like with
Same
that
position.
bend. And I would have never known had she not carried it that way, because she barely fell in it.
Sure.
And so that was how I knew that it was.
Sometimes it doesn't take much.
Yeah.
Some other things you guys might run across. Heart attack. Everybody know the signs and symptoms of a heart attack? Chest pain, pain in the arm, running up the neck, maybe into the back. They'll be pale, diaphoretic, sweaty. They're not gonna feel right. They're gonna be complaining about that chest pain. Also, with older females, they'll often present as flu-like symptoms and they're actually having a heart attack. The best thing you can do for somebody with a heart attack is give them aspirin. That is your frontline drug. That's our frontline drug. That's the first thing we're going to give them is aspirin. 325 milligrams is the dose, but whatever you can give them is going to be appropriate. If you can give them 150 milligrams, great. If you have a 500 milligram tablet, fine, whatever. Just as long as they get that on board.
What's the dosage on a normal aspirin bottle?
Pardon me?
What's the dosage on a normal aspirin bottle?
It varies because they have low dose aspirin that's 81, so you'd have to give 4. A lot of them will be up to 500, because they kind of bounce around. So, but yeah, and even if it's not, have them chew it. Even if it's not a chewable one, they're not going to like you for it, but it's going to help them out. The only other one is stroke. Stroke's going to present with deficit on one side, so they won't be able to use their arm. They may have speech impairment. They'll be slurring their speech. Facial droop's real common. Yep. You put your arms out, have them close their eyes, and they'll kind of drift off to the right like that, or the left, depending on which side it is. They may have trouble tracking your finger. All those things are indicative of a stroke. Biggest thing, most important thing for you guys that you can pass on to us if we're showing up, when did it happen? When was the last time they were talking normally, acting normally, walking normally, whatever that is abnormal now? When was the last time that they were themselves? Because the hospital has a drug that they can get called TPA, which will typically, not always, but quite often fix a stroke. there's a time limit on that. We only have between 3 and 6 hours now, depending on the person's conditions and their health history to get it. So that onset time is huge for us. I think that's it. Any other questions? They were giving us that you have to wrap it up. Nobody's moving. So.
Thank you guys.
Thank you.